Greetings, I am Dr. Karl Nath, the Editor-in-Chief of Mayo Clinic Proceedings. I am delighted to welcome you to the multimedia summary for the journal's September 2017 issue. There are 4 articles this month that have been selected as our Editor's Choice or Highlights articles. Our Editor's Choice is an original article that evaluated subclinical atherosclerosis in women with a remote history of preeclampsia. The article is authored by Dr. Vesna Garovic, a consultant on the Division of Nephrology and Hypertension and the Department of Obstetrics and Gynecology, and colleagues from multiple departments of Mayo Clinic in Rochester, Minnesota, the University of Belgrade in Belgrade, Serbia, and the Keck School of Medicine at the University of South Carolina. Preeclampsia is a multisystem hypertensive pregnancy disorder defined as new onset hypertension with proteinuria after 20 weeks of gestation. It affects approximately 5% of all pregnancies. In addition to increasing the risk for maternal and fetal morbidity and mortality, preeclampsia is a risk factor for future hypertension, ischemic heart disease, stroke, and premature cardiovascular death in women. To examine the relationship between a prior history of preeclampsia and the development of cardiovascular disease, Dr. Garovic and colleagues identified women with a history of preeclampsia and those with normotensive pregnancies using the Rochester Epidemiology Project medical records linkage system between 1976 and 1982. Participants underwent ultrasound imaging to determine carotid artery intima media thickness. This measurement is a marker of subclinical atherosclerosis, the latter a prelude to overt clinical atherosclerosis. Dr. Garovic and colleagues found that carotid artery intima media thickness was significantly higher among women with a history of preeclampsia. The authors also conducted a meta-analysis of 10 prior studies, the findings of which confirmed the present observations. Integrating these observations, Dr. Garovic and colleagues conclude that a history of preeclampsia is associated with, in later life, subclinical atherosclerosis, and that the detection of such subclinical atherosclerosis offers the possibility for early intervention so as to reduce the risk for overt clinical cardiovascular disease in this patient population. This article is accompanied by an editorial authored by Dr. Malha and August, which explores the relationship between preeclampsia and the risk for cardiovascular disease. Namely, is preeclampsia a reflection of underlying risk for cardiovascular disease in general, or does endothelial injury during preeclampsia set the stage for subsequent cardiovascular disease? This editorial underscores preeclampsia as a risk factor for cardiovascular disease and the need to educate women with hypertensive pregnancies about such attendance risks. Our first highlight article is an original article which describes palmoplantar pustulosis, its clinical features, etiology, and treatment, as experienced at Mayo Clinic between 1996 and 2013. The article is authored by Dr. Jeanette Olazagasti from the University of Texas Southwestern Medical Center and colleagues from the Department of Dermatology at the Mayo Clinic School of Medicine and Science, Rochester, Minnesota. Palmoplantar pustulosis is a chronic relapsing pustular eruption on the palms of the hands and the soles of the feet. The authors performed a retrospective review of patient records between January 1, 1996 and December 31, 2013, and the presence of such etiologic factors as smoking, stress, focal infections, the use of TNF-alpha inhibitors, and associated disorders. These disorders were thyroid disease, gluten sensitivity, type 2 diabetes mellitus, and the Sappho syndrome of synovitis, acne, pustulosis, hyperostosis, or osteitis. This analysis revealed that the majority of patients were female with a mean age of 45 years, and the most commonly observed risk factor was a current or prior history of smoking. Thyroid disease and gluten sensitivity were less frequent than previously described. Treatment regimens include topical corticosteroids in the majority of patients, and in the minority, phototherapy and systemic agents. Response to therapy varied considerably. The second highlight article examines the effects of canines on human sleep when canines share sleeping environments. This original article is authored by Dr. Salma Patel and colleagues from the Division of Pulmonary and Critical Care Medicine, the Department of Psychiatry and Psychology, and the Department of Biostatistics at Mayo Clinic in Rochester, Minnesota, and Scottsdale and Phoenix, Arizona. The American Veterinary Society notes that 37% of all American households have dogs. However, whether a dog may enhance an owner's nighttime experience has not received as much attention as the discussion of possible risks to human sleep. This question is timely, as the accepted opinion in the medical community is that pets should not be permitted in the bedroom at night, whereas a significant number of pet owners sleep with their pets in the bedroom. The authors recruited healthier adults without sleep disorders from Mayo Clinic in Arizona and who had only one dog older than 6 months in age. The majority of participants were women, the mean age 44 years. The dog breeds were diverse. Human participants were on ActiWatch 2 activity monitor that detects movement and light. Their dogs wore Fitback dog activity monitor that detects movement. The human participants recorded information about bedtimes, sleep aids, nightly dog locations, and sleep quality. Data were collected for 7 days. The authors concluded that a single dog in a bedroom did not adversely affect human sleep because, on average, humans with dogs in their bedrooms were able to maintain satisfactory sleep efficiency at a rate greater than 80%. This is quite comparable to sleep efficiency reported in the literature for community-dwelling healthy adults. However, in this study, human sleep efficiency declined if the dog was on the bed in contrast to simply being in the room. The authors underscored the need for additional studies that include control analyses, larger sample size, and other types of pets, such as cats. The third highlight is an installment in the Neurosciences Symposium, which discusses neurostimulation strategies that provide relief for patients with diverse neurologic conditions. These include medically refractory Parkinson's disease, essential tremor, dystonia, and obsessive-compulsive disorders. Other disorders under investigation for similar neurostimulation include Tourette's syndrome, treatment-resistant depression, chronic pain, alcohol and drug addiction, cluster headaches, and Alzheimer's disease. This symposium is authored by Dr. Christine Edwards and colleagues from the School of Engineering, Deakin University, Geelong, Victoria, Australia, and the Departments of Neurologic Surgery and Surgery at Mayo Clinic, Rochester, Minnesota. The authors note that although surgical procedures vary across institutions, specific neurosurgical technologies are quite commonly employed to ensure precise placement of the electrode leads. The overall deep brain stimulation procedure consists of 4 parts. First, preoperative assessment. Second, preoperative planning. Third, surgical implantation. And fourth, postoperative assessment. The surgical procedure typically takes up to 6 to 8 hours and involves an interdisciplinary team of neurosurgeons, neurologists, nurses, and technical support staff for the medical devices and associated software. In addition to discussing the advances in adaptable and precise neuromodulation therapy and relevant conditions, the authors underscore the need for a more complete understanding of the therapeutic mechanisms of neurostimulation for various neurologic disorders, thus enabling the discovery of biomarker feedback signals that effectively informed the closed-loop system. You can access these highlights and Editor's Choice articles free of charge during the entire month of September. Please visit our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org, where you'll find other relevant free content such as our Path to Patient Image Quiz, Art at Mayo Clinic, stamp vignettes on medical science, and interesting medical images. Please also access the social media buttons at the top of the homepage to follow us on Facebook, Twitter, and YouTube. Our website lists many news stories that are based on articles published in Mayo Clinic Proceedings. You can also check out our YouTube channel, where you'll find videos of full author interviews and our 60-second video article summaries. Please listen to our Mayo Clinic Proceedings fireside chat recordings, which is available through iTunes as well as from our website homepage. And as always, we greatly thank you for your interest and your support of Mayo Clinic Proceedings. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.